Hi, this is Modern Dental Assisting, Chapter 3. We're going over the dental assistant's role throughout the dental office. There are a number of roles that the dental assistant can have throughout the dental office. The first role is the chairside dental assistant. The role of the clinical assistant is defined as chairside assistant, also called the clinical assistant. That is working primarily with the dentist utilizing four-handed dentistry techniques. So when the dentist is seated and the assistant is seated and they are working together as a team, that is four-handed dentistry. So the chairside assistant is going to be doing things like preparing the patient for treatment, readying the setup for the procedure, assisting with anesthesia, exchanging instruments and mixing materials, and providing oral evacuation throughout the procedure, as well as keeping the patient informed and comfortable and relaxed. So there are a number of things that you'll be doing as a clinical assistant. So these are not all of the duties that you could do as a clinical assistant, but some of the duties you can do as a clinical assistant. It's going to depend on the size and the dynamic of your practice, exactly what you'll do as a clinical assistant. You may take on most or all of these roles as a clinical assistant, or you may take on one of the roles listed here as the clinical assistant. So it's always good to be cross-trained, meaning that you can do administrative functions and clinical functions, whether you are administrative assistant or a chairside assistant. Because, say someone in your office gets sick and you need to check your patient out, even though you are the clinical assistant, because there's not anyone at the front desk that day. You don't want to have, charts backing up or patients waiting or not being checked out because someone is not there. If you can do that, it will also make you more valuable because you are able to do more duties in the office. Or if you're an administrative assistant and the chairside assistant calls out sick and you're in a small office and they're just the two of you, the doctor doesn't want to have to cancel patients or work alone. So if you're able to step in and do the clinical assisting for the day while the chairside assistant is out sick, that will help the office run more smoothly. The next type of assistant we're going to talk about is a circulating assistant. So a circulating assistant, they serve as an extra pair of hands wherever needed throughout the office. So this is referred to as six-handed dentistry. So if you're already working in team dentistry and you have the chair side and the operator or the doctor working together in four-handed dentistry, and then the circulating assistant comes in and is working with them as in the team concept, then you'll be working with six hands, so it would be six-handed dentistry. It's more commonly seen in specialty practices that involve surgical procedures. So you might need the third person to monitor the patient, assist with the anesthesia, or exchange the instruments. When you are working in large practices, you might be lucky enough to have a sterilization assistant. If you don't have a sterilization assistant, this is added into your duties as a chairside or a circulating assistant. With a sterilization assistant, they have the responsibility for sterilization procedures. And in in other offices, the dental assistants and dental hygienists will share this responsibility. The sterilization assistant efficiently and safely processes all instruments and manages biohazard waste. So other things they might do is sterilization monitoring reports. The sterilization assistant is also responsible for selecting infection control products and performing quality assurance procedures. So they will do things like making sure that the spore tests are being run weekly or more often if needed, on the autoclave to make sure the instruments are being processed and sterilized when they're being processed. They may be getting the sterilization monitoring system reports back and loading them into the logs properly, making sure that all of the cleaning solutions are being switched out effectively when they need to be. Like the ultrasonic solution only needs to be changed once a day, but more often if it becomes cloudy. So they may be changing that more often. So anything that needs the maintenance part of it in the sterilization area, the sterilization assistant would take responsibility for that. Then there's an expanded functions dental assistant, and they're often called an EFTA, which are the acronym for expanded function dental assistant. They've received special training and they're legally permitted to provide certain intraoral functions beyond the tasks of general chairside assistants. They can bring real value to the dental team by taking on additional tasks and performing direct patient care under the supervision of the dentist. So the functions delegated to the EFTA vary according to the Dental Practice Act in each state or province. You have to make sure that you're practicing within your scope. It is your responsibility to make sure that you do not practice outside of your scope and that you don't do anything that you are not legally allowed to do within your state. If you do something that is not defined within the State Dental Practice Act and something that is not within your scope, you will be the one that is disciplined for that act. And then the administrative dental assistant is the last assistant, also known as a receptionist, and they're primarily responsible for the smooth and efficient operation of the business side of the dental practice. 2 or more assistants may work in the business area of the dental office, and the tasks of a business assistant include scheduling appointments, communicating on the phone, and coordinating financial arrangements for the patients. And they also handle dental insurance claims. It's not uncommon for a chairside assistant to move into a business office position later on in their career. It's helpful when a person at the desk has an excellent understanding of how the clinical practice functions so that they understand more of the terminology and what is being asked of them for the dental insurance claims.